Important issue right now. Dr. Jay Bishoff is the medical director of the Intermountain Urological department here at Intermountain Medical Center. He joins us in studio to discuss the dangers of the types of prescription drugs that are available to many of us. Let's talk about how big of a problem it is. It's the fourth leading cause here in Utah. It is the fourth leading cause. In fact, if today is just an average day, somebody either already died or will die today in the state of Utah from a prescription pain medication overdose. That's how big the problem is. You know, you think about heroin, other things like that, but you talk to the medical examiner, they talk about that. They talk about the opioid medication that's prescribed legally to many of us. Absolutely, and it's a huge problem because in Utah, as well as the rest of the nation, we're not alone in this problem. People across the nation don't see taking unused prescription pain medication as drug abuse, and it is just as serious as other drugs that are not legal. Walk us through how this becomes an issue. Say someone, legitimately goes to get surgery and they're automatically given these prescription drugs. They are, and that's one of the biggest problems. Our message in Intermountain Healthcare, helping to lead the way, working with other institutions and agencies in the state of Utah to try and combat this problem. So you're absolutely right. Patients come in for surgery, dental procedures, orthopedic procedures, chiropractic procedures, and they get narcotics. We're trying to say, you probably don't need the narcotics. Most patients need pain medication after a surgical procedure or a dental procedure, but most patients actually do not need narcotic pain medication. It sounds like we need a culture change, not only with doctors, but patients, of being dependent on, just because I went to the doctor, I need this pain medication. That's exactly right. In fact, we need a 360-degree approach. We need physicians, dentists, people who see patients and prescribe narcotics to prescribe none or far fewer. Number two, we need patients to say, wait a minute, do I really need to take this? We need patients to say, I'm going to take your prescription, but I'm not going to fill it until I've taken Tylenol, ibuprofen, other medications that aren't narcotic, not addictive, and then if I need it, I'll take it instead of automatically taking it. And then finally, we have to throw them out when they're not being used. It behooves us to watch out for our loved ones and to watch for them, to know that if you're done with your pain, to throw it out and not keep it at home. That is such an important message because we know physicians are overprescribing. We're trying to get them to prescribe less. We know that patients they use less than a fourth of all the current medications that they're being given for pain, and those medications stay at home, and your children, your neighbors, your grandchildren, people who are coming into your house for parties, church parties, other things, are taking those narcotics, and that actually is one of the sources of the big addiction problem that we have in the state of Utah and across the nation, and that alone would help us significantly reduce the number of deaths and, more importantly, or as importantly, the number of addicts that we have here in the state of Utah. It's truly a call to action, and you're challenging all of us to search your home, look at old prescription medications, and throw them out. Absolutely, throw them out. And I'll bet you, if you count those and look at them, you're going to be surprised. I'll bet you're going to see a decrease in the number that you thought you had in there, and they're not there. And that's because somebody in your circle took them. So much important information. Thank you. For more information, you can always go to Intermountain Medical Center's website and also our website at goodforutah.com.